You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering a facelift with new techniques. According to my guest here, Dr. Sundine, board-certified plastic surgeon, you can get natural-looking results. You say even their friends may not know what they did.
Absolutely
They just look rested. It's hard to believe you could do a facelift on somebody and all of their friends aren't saying, wow, what'd you do?
Absolutely.
Really?
Yes.
I mean, you hear that from patients?
Yes, absolutely. I mean, the downtime is very minimal from these procedures, even a full facelift.
Okay.
And they get back to their lives very nicely.
Now, what are some of the reasons you hear when they come in, why they're getting a facelift?
Well, it's interesting. I think for the women patients, it tends to be they're either kind of looking in the mirror and they're feeling like they're getting older and things like that. Or many times there's an event that's coming up where they want to look better for it. My son's graduating from college and I want to look good in the photos, or my daughter's getting married in 6 months and I want to look nice for the pictures and I don't want to look old. And so frequently for women, I think those are the cases. Or they're just getting in the mirror and they feel like they look tired or sad or angry.
I mean, do they want to look prettier? They want to look sexier? What do they say? Do they say any of these things?
I think what they want to do is look back to when they were youthful.
Okay.
And I don't think that, if the expectation of a facelift is you're going to look different, I don't think that's the facelift I'm going to give you. The facelift I'm going to give you is to restore you to hopefully 15 to 20 years younger.
Have you ever had somebody say that, where the partner, the spouse, whatever, says they look 20 years younger?
Yes. Yes, and
I mean, can a 70-year-old look 50?
Yes, and
70's young today.
And I've had wives who have not wanted their husbands to get it done because then they feel like their husband's going to be too attractive for them.
Okay.
So they're worried that their husband's going to be more.
Let him get old.
Right. Let him get old. I'll get the facelift and look nice. But
and what about the men that you say that oftentimes will talk their wives or spouses or whatever out of a facelift because they don't want them to look done?
Right, and I would say that that's not a fear with the facelift that we produce. I think if you looking at our previous patient, our after patient, she doesn't look done. She looks soft. She looks, with again that heart-shaped face.
Is that always in the hands of the surgeon?
I think it's absolutely.
And I know we're trying to stay positive today, but there are some noticeable, stretched, tight facelifts. I always think, is that a person that just didn't heal well? Is that a smoker? Or is it the technique?
I think it's the technique, and
I think
it's fully in the hands of the surgeon producing it, yes.
Okay. Now, one of the things, and I'm telling you we're out of time, but one of the things that I've never heard before, you were saying that you like to, and I can't find in my notes, that set people up for their second facelift.
Yes.
Tell me about that.
Well, with the technique we use, what we do is if you think about a patient who's coming in and they're 50 and they want to look nice. And let's say you get your 15 to 20 years out of it.
Because you're going to live to be 90, I guess.
You're going to live to be 90 or 100 anymore.
Okay.
And so if you're still interested in looking nice, you're probably going to need a secondary facelift. And so many of the techniques that other plastic surgeons are using are destructive techniques where they're taking out pieces of the mid-facial tissue,
that they may need later?
That you may need later, and also disrupt kind of nice surgical planes that you can use to reposition them.
Okay.
So what we do is we go in fully planning that we're going to need a secondary facelift.
But doesn't that give you less of a result, by the way, by not getting aggressive enough?
No, absolutely not.
Okay.
Because I can be just as aggressive, but I don't have to throw away this tissue. I actually reuse that tissue to help, for example, lifting up the SMAS. We'll actually use that tissue to support the neck and create kind of a hammock
So when you do a
effect.
55-year-old facelift, you're already thinking about, okay, I got to be careful because they're probably going to want to get something done in 30 years.
And I better.
It's a new approach or a new thought or philosophy with people that are going to be living to be 90 and getting two facelifts.
It may be, because you don't hear a lot of people talking about it. And actually one of the reasons I went to train with the person I did was because I heard him speaking at a meeting, and he started, and all the other surgeons were talking about their technique of facelifting, and he was already talking about a secondary. And he says, if you do that, your secondary is going to be ruined. And I went, this is a guy who sees it better than anybody had, which is why I went to spend time with him, because I think his approach. You learned his
facelift.
I've learned his facelift.
Okay. Now you go to a lot of these meetings, and they talk about facelifts. What are you guys doing there? You're sharing ideas,
absolutely,
new techniques.
And
the things change that much, and do you ever pick up some stuff that's...
Absolutely. You'll definitely pick up new techniques and things like that. I don't think so much in terms of facelifting. What I've been really more learning lately is just adjunctive techniques. I think
meaning
use of like recently in the last few years has been the use of like fat grafting, which has been a really, I think, a good adjunct, and frequently will be a nice thing to fill in some volume considerations, maybe even fill in the lips, accent lines on the lips, where you still have depressions afterwards following facelifting, or where there's just true volume considerations using fat, which is going to be living tissue, how to treat that well. Using fillers, using lasers and things like that.
Now,
I have to say I'm pleased with the facelift technique, and so far I haven't heard of a facelift technique in a meeting that beats what I'm doing.
All right, okay. Brows and eyes, we haven't even talked about it.
Right.
You do address brows and eyes. I mean, some people come in for a facelift and all they need is their brows? Or?
Absolutely. And sometimes, many times, they come in for their eyes and what they really need is their brow. And especially in males, well, you'll see they have really heaviness and they'll say, oh, I need my upper lids done. And you reposition their brow to where, and just on the patient,
isn't that a dangerous situation? I hear doctors saying, careful with the brows on a man, it can really feminize them or make them look freaky.
And that really comes back to your artistic impression, you know, and looking at it. And again, this is where looking at the patient's photos when they were younger, when they looked good, when they liked where their brow was, and then I want to say, I'm going to mark your brow, I'm going to put it back to where, here it is, and even marking the brow preoperatively, so that when the patient looks in the mirror, I'm going to look in the mirror and say, do you like this? Do you like this? And you know, this doesn't look good, and then marking that position so that in the operating room you set the brow where you both have agreed to preoperatively that patient look good.
Okay, final message. Somebody watching this, they don't like the way they're aging. What do you say to them?
Come see us.
Okay.
We'll take care of you.
You meet them one-on-one?
We'll meet them one-on-one.
Is it always you or some kind of treatment planner?
No, it's me. And from the minute, you know, after the initial usual paperwork of coming into an office, it's me. And it's a very, very detailed consultation with you and me in a mirror.
I want to thank you for coming on the show. And, you know, very interesting. We'll have to have you back. Because I know you do a lot of different procedures.
Yes.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or directed to a friend, you can visit our website at wellnesshour.com. Just do a search for plastic surgery or facelifting, and you'll find Dr. Sundine. Again, I want to thank you for coming on the show. Very interesting. For now, I wish you good health.